Okay, great. So I have the recording going, and I'll go ahead and get started with the talk. So first, let me introduce myself. My name is Stephanie Greer. My background, I have a PhD in neuroscience, and I'm the co-founder and CEO of Akin Mental Health. And what we do at Akin Mental Health, we are running a new program, but we're here to support families when you're caring for a loved one that struggles with mental illness. And I do have a background in neuroscience, but my professional background isn't actually clinical in nature, wasn't related to mental illness. My connection to this topic is really through my own personal experience. And my mom has bipolar disorder and struggled a lot when I was a kid, which changed my life in many ways, including inspiring me to study the brain and build this company. But this is a picture of my mom today. She is a loving grandmother. She manages her illness well. I would consider her to be in recovery. And I have a strong relationship with her, and I'd like to share this picture of her holding my son, which is also a reminder of family and how that's important. So that's a little bit about me and where I come from and why this topic is important to me personally. So today in the webinar, I'm going to start with I just did some introductions, start with some definitions around the topic. We'll dig into some important research around the impact of family on mental illness and on recovery. We're going to then cover 4 principles for families caring for a loved one with mental illness, and to just help have an anchoring and a guide point around that. And then some quick resources for families and a question and answer section. We'll be using the chat features and the Q&A features in Zoom for Q&A. So I'll do the Q&A at the end, but if you strikes you to type things out earlier, that's fine to use those during the talk. Right, so let's dive into the definitions. So we're going to be talking about mental illness, family, and recovery. So when we talk about mental illness, I think it's important to bring up the point of mental health versus mental illness. Some people talk about mental health, fewer people actually talk about mental illness. And it's important to point out that everyone has mental health, just like everyone has physical health, but not everyone has the added challenge of mental illnesses, similar to how there's an added challenge if you have a physical illness. And particularly mental illness requires different tools, medical tools, medications, doctors, therapies, hospitals. These aren't always the places that people get support for their mental illnesses, but often are encountering these systems and navigating, dealing with these challenges. And then in terms of the diagnoses, today this talk, the research is focused on diagnoses and disorders that have psychosis involved. So that's some of bipolar 1 disorder, and focus of the research I'm presenting is around schizophrenia and schizoaffective disorder. So these are some of the illnesses that the research is about today. So that's what I'm talking about and why I'm talking about mental illness. The second piece is family. So it's interesting, if you do a Google image search for family, what you'll often find is parents with young children. But family doesn't go away when we become adults. And a lot of people who are adults who have mental illness still need a lot of support from their family. But this doesn't have to be any particular type of family. So it's just people in your life who care about you. And we all have people in our lives who care about us. Sometimes biological relationships are a part of family, but not necessarily. This could be friends, close companions, things like that. So that's who we're talking about with family. And recovery is a big topic. It's hard to define and nail down, but we're talking about essentially living a life of flourishing, whatever that means for you, while managing a mental illness. So whatever that life looks like. It's really a journey rather than a destination when we talk about recovery, and it looks different for everyone. Life still has ups and downs, and there can also be relapse and changes during recovery as well, but it's living that life that's worth living for you and that you want to flourish in. And I want to highlight a few people who openly talk about their lives with these mental illnesses and their life in recovery, because people in recovery come from all walks of life. So I'll highlight Andy Dunn as a recent book about his journey with bipolar disorder while being an entrepreneur, founding Bonobos. Ellen Sachs is a law professor, legal scholar, who's written a book about her journey with schizophrenia. There's also a woman down the street from me that runs a coffee shop that part of the theme is related to her challenges with schizoaffective disorder. Rachel Starr Withers runs a podcast about schizophrenia. So it's really the whole mix of life, and it's really helpful to highlight some of these stories and personal journeys of recovery, so that we can see what this looks like in real life. But today, I'm going to be talking about how these three things are connected. So mental illness, family, and recovery. And it's pretty clear anytime you talk with someone about their mental illness recovery, that there's some kind of link between family and recovery. And this has been studied in research in various ways. And as people look at the journeys of recovery, the links would show up. So one link is that supportive family relationships would often be really strong predictors of recovery. And they're actually one of the strongest predictors of people engaging in treatment for mental illness and sticking with treatment and mental illness, is having relationships that they feel supported in. But there's also research on families and conflict in families resulting in relapse and disrupting recovery process and mixing up with the disorders and the symptoms. And often this is talked about in the research around families expressing criticism and getting into conflict. So there's a dynamic of the families both promoting recovery and promoting relapse in different situations and kind of navigating that, which makes sense for mental illness. These are complicated people with complicated lives, complicated relationships. But there's more to the story about impact, and I'm going to kind of take you through a journey of a research study of research studies. It's called a meta-analysis. This is from a paper that was published in the Lancet Psychiatry, a really important psychiatry research journal, and tried to answer the overall question of what interventions can reduce relapse in schizophrenia. So broadly, trying to answer that question. And they combed through as many studies as they could to find places where researchers had looked at someone with schizophrenia or a psychotic episode going to a hospital. They would get a prescription for medication, usually, because that's treatment as usual for this type of illness from the hospital. But they were really looking at what, in addition to that, could help get to recovery, what interventions could be done. And so when I'm talking about interventions, I mean sort of like treatment mechanisms that could be done in addition to the medication that could help. Because medication alone is really not working that well for many folks. And so they pulled all of the research together and looked across these 19 different types of things that scientists had tried, and ran an analysis to identify which ones had better evidence than others. And some of these interventions included some element of including the person with mental illness's family in the treatment, and most of them didn't. But when they ran the analysis and compared all these studies to treatment as usual, which is really just medication, what came out was family interventions was actually the #1 most effective addition to this. And then the results were a 50% reduction in relapse 1 year out. Now here, they're talking about relapse mostly in terms of returning to the hospital, which isn't a complete story, but that's a really dramatic effect for folks. So 1 year out, going from a 35% chance of returning to the hospital down to a 16% chance. And imagine that's a dramatic difference in people's lives. And so it's really interesting to see that it's this family intervention, this family focused approach that's driving these really powerful results. So to understand more about what this family intervention is, what they were studying, if you think about kind of a normal type of treatment that somebody might have, there's a care team, whatever that looks like, and the individual experiencing mental illness. And those people are working together, sometimes productively, sometimes not productively, but working together on the treatment. And the family's kind of off to the side, and sometimes very rigidly boxed out of that equation, and sometimes, getting some information from the loved one with mental illness or not. And a family intervention really reimagines this, expands the care team to kind of think of encompassing everyone. And there's contact between the professionals on the team and the family, as well as, professionals and individuals, the individual in the family, this kind of dynamic. And some family interventions actually involve just the dynamics of the, some professional part of the care team working with the family directly without the individual. And some of them include them all together in the same session. But it's really about working with the family and also reimagining this care team so that it's the whole group of people that are around this individual with mental illness. And the aims of the family intervention. So I included the text from this research paper on the left here. It's a little bit longer, and then kind of try to summarize it in orange here on the right. But the aims are really to get everybody on the same team, to help reduce conflict in the family. And there's often conflict that's caused by the mental illness. It makes a lot of sense. Improve problem solving with the family, also build empathy and understanding around the patient. So helping to understand, what this disorder might be affecting in the family, and improve the family skills and mindset. So the way that they can interact and the way that they're thinking about what this illness is and what it means. So that all takes work and participation. That's what the family intervention does, is helps the family with all of those issues. There's one more, and to kind of illustrate this in a different way, I really appreciate this comic from Liz Polson that she made, but this is kind of about conflict in general. But if you think about if mental illness creates a lot of conflict in family inherently, then there's a lot of you versus me. And what's being done kind of in the intervention is trying to get people on the same team, the me and you against the problem point of view, which can be a lot more productive for families. So that's another way I kind of think about illustrating that. So there's another study that I want to introduce you all to that looked at some of the longer term impacts of family involvement. So this study was conducted in England, and there were just over 500 people treated for a first episode of psychosis. And they had different treatment protocols that some of them involved, had kind of full involvement of the families. Some of them, there was no involvement with the families. And then they looked 10 years later to see what happened in 10 years. And what was really amazing about these findings was that there was a 90% reduction of risk of unnatural death when there was full family involvement versus no involvement. And so what they were showing was when there was this full involvement, it goes beyond just recovery and going to the hospital, but really saving lives and changing the trajectory of how the mortality of these diseases. So these are really amazing findings. That's why, I titled the talk, The Remarkable Impact of Family, showing that there can be a dramatic reduction in hospitalization, a dramatic improvement of risk of death when the family is involved and supported. And so the story that this research is showing is that the link between family and recovery is very strong, but it's particularly dependent on when the family can be engaged and also have their needs supported in the process of caring for someone, because it is a extreme challenge for everyone involved. So these interventions are really designed to support the family, and that enables this link to the strong recovery period. So the thing about this is, and it's been incorporated into best practice, but this is really not what we experience as families or as anyone with mental illness. So, what we experience is often that mental illness is very isolating. The symptoms themselves cause isolation. They cause people to push people away or retreat into their own world or their own space. And additionally, the culture is often of isolation. So we talk about individuals needing to, take responsibility, or families are expected to stay out of it. There's a cultural push to give people space to not be involved. And then treatment as usual is usually also designed to isolate. So whether that's treating people in restrictive settings, or the privacy laws that become barriers, or just individual treatment being the only option that people have, those all create isolation. And so what happens in kind of the treatment system is that people can be very isolated, when in fact the research is showing that if we can fight against that isolation, if we can bring family in and work together, then that's a much more successful approach to mental illness. And this makes sense because mental health really happens in relationships. If you talk to someone about their experience healing from mental illness, or what they value in their life, it's always the people in the life that they care about and that they want to have those strong, healthy relationships. And that's true for people with mental illness, or people without mental illness, or anybody in between. So it makes sense that there's this research supporting that if we support the whole family, if we support relationships, that we can all be healthier and be recovered together. So that's kind of the research and what we're seeing in how much family is impact, and involving family has a big impact. And I want to take you through 4 principles. I know that a lot of you are families caring for loved ones with mental illness, and we have kind of 4 principles to help kind of guide you and point you in the right direction when thinking about this challenge. So the first one is, it's not your fault. So I want to make that clear that this isn't what the research isn't showing that families cause these problems and that's why their involvement is necessary. Actually, the illness is no one's fault, and they're just as likely to arise in families that are, functioning normally and healthily as families that are not. It's getting everyone aligned to get around the illness rather than thinking about whose fault. So the importance of this principle is to let go of the blame game and stop arguing about whose fault whatever it is. It's really no one's fault. It's an illness. The other thing I think it's important to remember when thinking about it's not your fault is if you can let go of the idea that it's your fault, particularly parents that I talk to, also let go of the idea that you have control to fix it too. There's something greater going on, and this principle can kind of help in that way. But the second piece is your response matters. And that's really what we're pulling out of this research that I presented today. So the way that a family member engages or doesn't engage in conflict, or the way that they communicate what they want, or the way that they handle a crisis situation, all of those make a huge impact in the trajectory of the disease itself, the trajectory of the mental illness. Families, I just want to spread the message that there's a lot that you can do and that you can learn, because your response really matters, and it really makes a big difference in the lives of your loved ones, which I'm sure that you already feel yourself. The third principle is you matter. So it isn't just that you're a one-way, caregiver or provider of services the way that, a professional might be. You matter, your well-being matters, your needs matter. Getting to a relationship that feels balanced and reciprocal matters in this process as well. And that's what some of the research is showing too, that it's not just about having a family that's, giving up everything to support a loved one, but a family that gets to a place of being a cohesive, loving family that everyone matters and everyone's needs matter. That's an important principle to keep in mind, and something that can be hard to do when you're focused on someone else. And the fourth principle, I want to phrase this right, but professional care teams treat the mental illness, not you. So this isn't to give you the message that you are treating them, but you want to actually be on a team. And what can be really frustrating, I think, is for families trying to organize that team often in the mental health system and get that going. But you're really part of a team. If there isn't a treatment happening or treatment in place, then it can be very hard to manage this on your own. It's like managing someone with another type of illness, like a broken leg that's not getting treated or something like that. There's a limit to what a family can do in terms of treatment. And it's helpful to have that principle remind you that you want to be part of a team and part of a set of people working to solve problems together. So those are our 4 principles from Akin that we pull from this research, and that we hope will help on each of your journeys as you're caring for loved ones as well. So to transition into where to get family support, it's really challenging to access this, even though this research is shown to be best practice, but just some points in the right direction. So a lot of you might be aware of NAMI. They run regional support groups, and particularly a family-to-family class, which has an educational component to it. And they're a national nonprofit organization. And then there are models of care that you can look for as you're looking for treatment for your family and your loved one, including first episode psychosis programs, which have a strong family component, multifamily groups, something called open dialogue, behavioral family therapy. There's also a program called Psychosis Reach. So it can still be hard to find these resources. I don't want to kind of overwhelm people with the search, but it's helpful to know where to look for programs that are focused on supporting families and your needs. And of course, at Akin, we're building programs for families as well. Currently, we offer Akin Family Circles, which is weekly group sessions where we work with families and groups on lessons to help reduce stress, improve relationships, and build expertise in the mental health system for families caring for loved ones with severe mental illness. You can find us on our website, and we'll also be emailing out a link to everyone from this session for a discount code if you're interested in joining. So that's the presentation on the remarkable impact of family and mental illness recovery. And I know that you all must have a lot of your own personal experiences to bring to this. So I just really love to open it up to the chat and the Q&A and hear from you and have a chat-based discussion about this. So thank you very much.